workers either show proof of vaccination or face weekly COVID testing. This, as projections show, we can see additional deaths in the thousands per day if this surge is not arrested. We begin tonight with Miguel Almaguer.
Well before any fall surge, tonight some hospitals across the nation are already struggling to manage the 60,000 new daily COVID infections plaguing the U.S. As ICUs fill up, some models suggest our nation could see upwards of 4,000 deaths a day by October. The 100 million Americans who are unvaccinated driving the numbers and the risk, even for those who are inoculated.
If you allow the virus to freely circulate because so many people are unvaccinated, you give it yet again another opportunity to mutate even more, and you may wind up with creating a variant that in fact eludes the protection of the vaccine.
As new inoculations plateau, Pfizer and Moderna, at the FDA's urging, are expanding the size of their vaccine studies in children 5 to 11, amid rare reports of heart inflammation in younger Americans. A precautionary move, like the idea of bringing back masks indoors nationwide, said to be under active consideration. Today, St. Louis County joining Savannah, Georgia in re-implementing the policy.
These numbers are too alarming to ignore.
As major medical organizations say vaccination should be mandatory for healthcare workers, today the Department of Veterans Affairs became the first federal agency to require vaccinations for medical staff.
Veteran Affairs is going to, in fact, require that all docs working in facilities are going to have to be vaccinated.
The state of California and New York City also announcing public employees will soon be required to show proof of vaccination or face weekly testing.
Individuals' choice not to get vaccinated is now impacting the rest of us.
With health officials confirming booster shots could be needed for Americans 65 and older, as well as those with compromised immune systems, tonight COVID cases are rising in every state, and so is the risk to all Americans, including the vaccinated.
Miguel, I know in Los Angeles, they're not just seeing a lot of cases, they're seeing a lot of very sick people.
Yeah, Lester, the Delta variant is now accounting for 21% of those who are hospitalized in LA County. They are in the ICU, in part because so many Americans are getting so sick. There's a growing push for employers to mandate vaccines. Lester?
All right, Miguel Almaguer, thank you. A worsening situation tonight in Alabama. That's the state with the lowest vaccination rate. Hospitalizations are surging, and the governor has been quite blunt about it all, blaming it on the unvaccinated. Gabe Gutierrez is there.
At the University of Alabama at Birmingham, today ICU nurse Barbara Thornton learned that one of her COVID patients in her 20s had just died.
Truly sad to see people so sick and to see their families suffer because they can't be with them in the hospital.
Did you think that there would be another wave of this?
I honestly didn't. I thought that we were on the other side of it.
And yet, hospitalizations in Alabama have soared more than 300% since July 1st. Just 34% of the state's population is fully vaccinated, the lowest rate in the country.
It's time to start blaming the unvaccinated folks, not the regular folks. It's the unvaccinated folks that are letting us down.
Over the weekend, this hospital saw a sharp rise in COVID patients from 35 to 48, far less than it had seen back in January. But these patients are much younger.
I think there are a number of reasons that people are hesitant to get vaccinated here. There's a lot of mistrust of government mandates, of guidance that comes down from on high.
Here and across the South, that mistrust runs deep. Tennessee-based conservative radio host Phil Valentine didn't think he needed the vaccine, but now has changed course after getting COVID and ending up at the hospital in serious condition.
His not getting it influenced other people not to get it, and that is the regret of his life.
Medevac pilot Ricky Ham did get vaccinated, but tested positive 3 days after getting the shot before it fully took effect. He'd spend 187 days at the hospital, and now has this message for those still skeptical.
Nobody wants to go through this, and a lot of people that went through this didn't come out. Is it worth not taking a shot? That, to me, is stupid.
Here in Birmingham, this hospital's lab says that all 31 of its most recent COVID samples have come back positive for the Delta variant. Lester?
Gabe Gutierrez, thank you. And make a plan for where to get vaccinated. Visit planyourvaccine.com for more. So let's take a closer look now at that tropical storm. It's packing winds of 45 miles per hour. Landfall expected north of Tokyo Tuesday night or early Wednesday, bringing up to 4 inches of rain. While in the U.S., dangerous heat extends from the Gulf Coast to the northwest. Some areas will see temperatures well over 100 degrees. In just 60 seconds, the thousands of homes threatened at this hour.